Thank you so much to you all for joining us today as we celebrate the opening of the new College of Nursing academic block at the Duncan Hospital in Bihar in India, which is part of the Duncan Centenary Vision Programme. The Duncan Hospital was founded in 1930, so that's nearly 100 years ago, by Scottish surgeon Dr. Cecil Duncan. So we'll reach its centenary in 2030, which I'm sure will come around very quickly. A bit later in our call, we'll also be announcing our exciting plans for the future of our partnership with the Duncan Hospital and beyond. Many of you here today will have helped to fund this work, and we would like to thank you so much for doing so. I hope you like what you see in the very short video we've created, which the footage was taken from the opening ceremony of the College of Nursing academic block, which we will play shortly for you. So Sarah Gibson, our Director of Programmes, joins us today. Sarah, the Duncan Centenary Vision was EMMS' largest programme to date. And for those who don't know what it's all about, could you just tell us a little bit about it, please, and where we are with it now?
Sure, thank you, Kirsty. So the Duncan Centenary Vision was a £4.5 million programme which began in 2018. In preparation for the centenary of the Duncan Hospital. It was EMMS' largest programme to date and brought together several pieces of work to build towards the Duncan Hospital's sustainability for the years to come. The Duncan Centenary Vision is in two phases. The first ran from 2018 and will end in 2026. And this phase saw a number of different activities. One was the healthcare career pathways. This is an approach that EMMS has developed and innovated, learning from operating small-scale scholarship schemes previously. EMMS has shown that scholarships alone is not sufficient to overcome the cultural and gender barriers to pursuing a healthcare career. So EMMS has developed the healthcare career pathways to increase successful outcomes for the most disenfranchised women and girls. To do this, we identify barriers and seek to overcome these by providing a range of supportive measures to encourage vulnerable women and girls to continue in their further education. This can include supporting the families and communities to support their relative to pursue study, access to English language training prior to starting study, as the courses are taught in English, essentials such as books, learning tools, accommodation, and food throughout their studies, and I think this is a critical point, a guaranteed 2-year paid position at the hospital where they studied, as well as the fees. So this approach is beyond simply the fees. Many hard-to-reach health facilities are unattractive to healthcare professionals who have trained in more urban areas, whereas EMMS Healthcare Career Pathways works with women from the community in which the hard-to-staff facility is based. And these women are happy to be able to not only study there, but work in their own communities and also help their communities, both providing health services and acting as a role model to young women in their communities. So that was one of the pieces of the Duncan Centenary Vision in the first phase. Another activity we did, we upgraded the Champapur Clinic. Unfortunately, the first phase was interrupted by COVID, and so we pivoted our support to support Duncan during that critical time in delivering services. And then we moved on to installing solar power and, of course, building of the College of Nursing academic block, which we are celebrating today. The last piece of this phase, phase one, focuses on building new halls of residence, and that the plans for that are currently being developed, and work for the halls of residence is scheduled to be completed by 2026. Halls of residence are very important in the Indian context, as it will enable Duncan Hospital to offer degree courses and attract fee-paying students from further afield.
Thank you,
I think
Sarah.
that's
Yeah, so we've raised all the funds for phase one of Duncan Centenary Vision, thanks to several generous donors, and particularly Duncan Hospital Charitable Trust and the Mackay Clinic. And we're waiting with great anticipation for the completion of the halls of residence in 2026. Now, I'm sure you're probably quite interested to see the opening ceremony of the academic block. So that ceremony was took place on the 23rd of November. So here's a short video of that, which I'm going to attempt to show you.
This is looking absolutely beautiful. I've been here probably about once a year for many years, and every time I've come here since the building started after the pandemic, it looks better and
The college is outstanding and finished to a really amazing standards. And we're really grateful to the team at the Duncan Hospital for sending over the footage, because I'm sure you agree, it's just really heartwarming and lively and just brilliant. So quite envious that I wasn't there, because it looked like a great party. So Sarah, what's next for the Duncan Hospital's future with EMMS International?
Yes, so this is the exciting part. Today we can announce we are embarking on a bold new chapter, phase two of the Duncan Centenary Vision, and we're calling that Duncan Futures and Beyond. It's a multi-phase initiative to further drive the financial, economic and healthcare sustainability, taking elements of our vision beyond the Duncan Hospital. Duncan Futures and Beyond aims to further develop healthcare delivery at the Duncan and further afield. The ambitious programme includes the construction of a state-of-the-art outpatient department and a museum at the Duncan Hospital to serve as a tribute to its legacy and a symbol of its future. Simultaneously, we're taking our learning from our Healthcare Career Pathways programme at the Duncan to identify, mentor and support academically talented but vulnerable women and girls in an additional 6 communities across other resource-poor states. These young women will train to become general nurse midwives, nurturing the next generation of female health professionals who will inspire change in their own communities. By extending our support to additional rural hospitals, as well as continuing at the Duncan, we're creating skilled employment opportunities in healthcare for local communities and empowering vulnerable women and girls to achieve economic independence. At the Duncan itself, we're further enhancing hospital infrastructure, further developing the workforce, and providing an inspiring and attractive place for staff to work and patients to receive care.
And Sarah, why is the new outpatient department so essential?
So an outpatient department at a hospital is very important. Outpatient care is there to maintain and improve people's health without the need for them to stay in hospital. And this is highly beneficial for 2 reasons. It enables people to access the treatment they need while continuing to take care of their other responsibilities, work, family and childcare and so on. And from the hospital's perspective, effective outpatient services can be a primary mechanism to deliver urgent care, reducing the need for hospitalisation, which is more costly and requires more resources.
So Sarah, could you tell us about a girl that Healthcare Career Pathways at the Duncan Hospital has supported? Maybe a little bit about her life and the difference the programme has made to not only her, her family and the provision of healthcare and the sustainability of the hospital, please.
Sure. So I'm I'm going to tell you about a young woman called Adria. Adria is from a small town where there are high levels of illiteracy and significant burden of disease. Children in that community usually drop out of school to help their parents in doing house chores, with villagers' primary source of income from agriculture and casual labour. Child marriage is also very common as a means of decreasing the burden on the families. Andrea's father was a driver who sadly passed away in September 22 due to liver disease caused by alcohol addiction. Adria's mother is a housewife, and she has one younger brother and sister. As the eldest in the family, Adria wanted to support the family, but had no idea how to do that. She was very sad and felt very hopeless thinking about her future, and there was no one there to guide her. At that time, in 2019, Adria learned about the general nurse midwife program at the Duncan Hospital. She actually learned about it from her father, who was still alive at that time, who had heard about it from Duncan staff. Adria applied to Duncan Hospital for the general nurse midwife program, but due to her limited English proficiency, she was not admitted. Thankfully, Dr. Vandana, who is EMMS Healthcare Career Pathway Lead in Bihar, heard of Adria's situation and supported Adria to improve her English over a 6-month period. This enabled Adria to reapply and subsequently be admitted to the GEMS College to train as an auxiliary nurse midwife. Adria was able to accept this opportunity as the healthcare career pathways were able to support her financially, both in terms of fees and living costs. Despite coming from a low-income background, she was committed to working hard and performing her job consistently, which helped her to complete her course successfully. Constant support of her family and the team helped her to cope with the challenges. Dr. Vandana's unwavering support throughout the program was also a great strength to her. She often used to visit her at college and stay in touch with her. Whenever there was a problem, Dr. Vandana and her team were there to help sort that out. After successfully completing her course, she is now working at the Duncan Hospital, and she's able to support her family and provide for her younger siblings. Adria is incredibly grateful for the support she has received, and she now lives with hope for her future. Healthcare career pathways helped Andrea to become self-sufficient and independent, and Andrea and her family are very grateful for the opportunity and recognize it helped them to move on with their lives despite all their challenges.
And Dr. Vandana is actually on the call today, so hi. It's lovely to have you here. So Sarah, can you tell me a little bit about the new developments and how much they're going to cost?
Sure. So as we said, we are looking to set up a project to build build the new outpatient department and small museum. And this will, along with supporting the healthcare career pathways, cost a total of 3.4 million.
Right, so that's a lot of money, a significant amount of money. So how are we planning to raise that?
Well, thanks to a very generous donation from the Mackay Clinic and support from several other donors, we have raised 877,000 so far, with a further 2.5 million pledged. We must now look to raise the remaining 300,000 over the next 3 years from other sources.
So that's really brilliant news, and we remain hopeful that we can raise the last £300,000 to allow the programme to happen in its entirety. Thank you for that, Sarah. So we've received a question about the Christian outreach of the Duncan Hospital and how it has been affected by the repression of religious minorities in India.
Thank you, that's a great question. In recent years, the Duncan Hospital has been very careful not to be spreading Christianity, not to be evangelizing, other than through doing good works and being seen to do good works. It holds the Christian services and prayers inside the campus amongst its Christian staff. The government and community appreciate Duncan Hospital for the excellence of its health service. For example, during COVID, the government used Duncan Hospital as one of its treatment centres. We work with it because it's a good hospital. it's a good hospital founded on Christian principles, and it serves everyone, regardless of their faith, as a model of excellence.
Thank you, Sarah. It's been brilliant to hear your insights. So finally, I would really like to remember in our thoughts and prayers today several EMMS supporters who spent much of their lives at the Duncan Hospital, helping to set up healthcare in this very poor part of India. We would like to pay tribute to those who are no longer with us, having passed during the construction of the College of Nursing, but supported our work and our plans to continue to develop access to quality healthcare at the Duncan and beyond. These include Elizabeth Rogers, who worked as a nurse and trained many others at the Duncan Hospital, Dr. Keith Sanders, who was Chief Medical Officer at the Duncan Hospital, and David Duncan, the son of the Duncan's founder, Dr. Cecil Duncan. So from all of us at EMMS International, we would like to thank you all so much for your support. Thank you for being here today. And we wish you, your families and your friends a wonderful Christmas. If you would like to find out more about Duncan Futures and beyond, the website is just here. You'll see it above me on this background here. I will also send a recording of this video. So this call has been recorded. I will send it to you shortly. So please feel free to share that with anybody who you think would be interested in finding out more about Duncan Futures and beyond. So Merry Christmas to you all, and thank you so much for joining us. Thank you.